My name is Brad Heineck, and we're talking about total knee replacements. What I'm going to talk about is strengthening of your knee, two specific exercises that are critical to help you with your walk and your balance in the long run, as well as getting started. And the first one we're talking about is quadriceps. So the quadriceps are these big muscles right here, very responsible for keeping you upright and moving. And we want to get those muscles working. They've turned off after the surgery. It's the body's natural response to surgery. We want to get them strengthened. And once you can get your knee to the point where it's this straight, it's time to start doing quadriceps, which is relatively early after surgery. One way you can do this is in the chair. You're going to get your bottom forward in the chair. Make sure you have armrests you can rest against. Get the knee as straight as you can, and then simply try and straighten your knee. And to do that, the quadriceps must contract. Okay, you can see my knee straighten. Your knee may not straighten this much. You may only get this much, but at least you're getting some movement, and those quadriceps are kicking in. You can put your hands there and feel them, okay? That's biofeedback in a basic sense, and that can help strengthen those quads. Okay, the next one in the chair, to also get the knee motion and the quads working, you're going to scoot yourself back in the chair. A firm upright chair works best. Sit with armrest, good posture, and you're simply going to try and lift the leg up in the air without any assistance. Okay? In other words, in therapy, your therapist may help do that, or you could use your other foot to help lift it, but we want to work on quad strength, so we're going to work on up and then down, and then up and then down. Okay? Thank you, Bob. Another thing you can do to help support the knee is right here, take a towel, just roll it up, put it right here, and that gives more support and it makes it easier to do your quad sets from the chair. Okay? I do want to say both of these exercises can be done very effectively laying down. Now I know you're not going to get on the carpet at home, but I'm going to do it here. And imagine we're on your bed at home. Alright. So you're laying supine on your back. And we're going to do straight leg raisers. Okay? You're going to take your good leg, bring it up like this. Alright? Get a pillow there, get comfy. Okay, have your spouse get you something to drink after your exercises, make them work for you.
I want to help you out, Brad.
Okay. It's always better to have two people when you're going through rehab. You have a spouse or a family member. There we go. All right. This knee is up. This leg stays as straight as you can, and it's called a straight leg raiser. This works the quadriceps, it works the hip flexors, all very important muscles as part of walking. Okay, you're going to bring it up as far as you feel comfortable, hold it for a second, and go back down. Okay? The idea is not to go fast, it's going to be hard to do that anyways, and bring it down with control, and don't do that because that will be painful. Okay, so that's straight leg raisers. The next one is quad sets laying down. What I like to do is if you have, this is a roll I have, or you can use a towel roll, and you're going to put it underneath your knee. Okay? What that does, this is where someone helping is good too, is you're going to try and squish that roll. If you got a foam ball, a little Nerf ball, that works good. You put it under there, give you something to squish against, and that's all quadriceps, plus you're straightening your knee as well. Okay, and you're going to do 10 to 15 of those, as well as 10 to 15 of the straight leg raisers. And after that, you may want to ice your knee or rest, whatever it may be, take a nap. Thank you. Okay, continuing on with total knee replacements, I want to talk about using cold packs on your knee. It's very common. Almost everyone uses cold packs after their total knee replacement. One thing I always do with my patients is at home when they do use their cold packs, they oftentimes use a recliner. And I don't have a problem with people using a recliner. You can get your feet back up. We can elevate the feet, which is good for decreasing the swelling. And you can also work on straightening the knee if you do it properly. You can also do it in a chair like this, okay? And put another chair in front of you, and we're going to bring the knee up as such, okay? The height of this chair is going to make a difference. This might be a little high for a lot of people early on in the phase, but you'll just have to get a lower chair, or an office chair, you can just lower it manually, okay? You're going to bring the knee up. Now, you want a little stretch on the knee when you put the cold pack on. You don't have to stretch it real hard, you've already done that. We just want to cool it down, but a little stretch is better than keeping it real flexed or bent. Okay, bring it up. So we got some elevation here, so it's going to help lessen the swelling along with the cold pack. And you put a cold pack right over the knee like that, and the typical response is, that feels real good, especially after you've worked it and stretched it for the previous 10 or 20 minutes. You put the cold pack there. Now with some people at home, they'll have their cold pack, and there's cold packs you can actually make, and following this section of the video we go through a section on how you can make a real simple and cost-effective cold pack that works for your knee. You want to make 2 of them possibly. Take one, put it underneath your knee, and the other over the top, and you totally surround the knee with that cold pack, and you get the complete package right there, cooling that knee down, decreasing the swelling. And again, you get the elevation there, so the fluid gets back into the system. You can add ankle pumps, is what they're going to talk about in the hospital when you leave. Ankle pumps are nothing more than working your ankle back and forth like this. It works the muscles here, helps reduce the swelling as well, getting the fluid moving, and it keeps your ankles stronger for when you're walking. So you're going to do 20 ankle pumps, give it a rest, sit back and relax, and you can do 3 sets of 20 while you're there cooling your knee down for 20 minutes.
Brad, before you stop there, I just want to make sure, you want to mention that sometimes with the ice pack, you want to make sure that there's a piece of material between the ice pack and your knee.
Good point. Bob just brought up, when you use the cold pack at home, you never want to put the cold pack directly on your skin. Always make sure you have a towel. If you have some sweats on, that's good. If you have real thin material, if your pajamas or whatever you're in are real thin, you might want to put an extra towel there so we have a little insulation between the cold pack. It's possible if you've got a good cold pack, you could frostbite your skin, which is not desirable at all, so make sure we have some insulation there with cloth. Thank you. Now another thing to address with cold packs is, what can you use at home with cold packs? With my patients, oftentimes they don't want to, or they don't have the funds to go down to a pharmaceutical store and buy a cold pack, a nice new one, especially for the back where you need a larger one. It's gel filled, they're very nice, but they're very expensive. Okay, chances are you're going to need the cold pack for a week or two, and then what do you do with it? Well, if you want to spend the money, you can, but there are other options that work equally as well as a bought and cold pack. One of them that I use, and I have for over 10 years now, is I have a recipe for a cold pack, and here it is. We have Ziploc bag, okay, and we simply take 1 cup of rubbing alcohol, pour it in the bag, take 4 cups of water, pour it in the bag, and mix it up, okay? Excuse me, Lindsay, but I'm going to use your bag, okay? When you do that, you want to get all the air out and zip the first one up, and then you're going to put a second bag over the top of that, just so you have some more mechanical strength so it doesn't break open, because they will break open. The worst that happens is you get a little water mixed with alcohol and it evaporates and it's okay. But they work very well. Make sure you put it in the freezer flat like this, and when you pull it out, it'll come out in slush form, so it actually will conform to your body just like a bought gel pack will. They work excellent. I've been using them for years, as I said, and my patients are very happy with them. I hand out the recipe regularly.